Hello, everyone. Welcome back to another episode of our 100 clinically oriented anatomy questions. This is question 46, and let's get straight into it. The question says the swollen and painful left foot of a 23-year-old female long distance runner is examined in the University Orthopedic Clinic. She states that she stepped on an unseen sharp object while running through the park 7 days earlier. Emergent surgery is ordered to deal with a tarsal tunnel syndrome. The tarsal tunnel is occupied normally by tendons, vessels, and nerves that pass beneath a very strong band of tissue, the lacinates ligament, on the medial side of the ankle. What is the most anterior of the structures that pass through this tunnel? Flexor hallucis longus tendon, plantaris tendon, tibialis anterior tendon, tibialis posterior tendon, and the tibial nerve. So the lacinates ligament is also the flexor retinaculum, alright? So yeah, the lacinate ligament is also the flexor retinaculum, and it is basically a broadband fiber that transports the posterior compartment structures to the sole of the foot, basically. So the patient has a tarsal tunnel syndrome. So tarsal tunnel syndrome basically has to do with the compression of the tibial nerve in the tarsal tunnel. That is what it is. But the question did not ask us that which nerve was compressed or what caused the tarsal tunnel syndrome. The question asked us the most anterior structures that pass through the tarsal tunnel. So yeah, here's it. This is tarsal tunnel. This is basic summary of the structures that pass through the tarsal tunnel from the anterior to the posterior. And the mnemonic is thumb, dick, and nervus artery. So thumb, dick, and nervus artery. Thumb is tibialis posterior, dick is flexor digitorum longus, and posterior tibial artery, nervus, tibial nerve, and the artery is the flexor hallucis longus. So from anterior to posterior, the correct answer is the tibialis posterior. So the tibialis posterior is the most anterior of the structure that pass through the tarsal tunnel, while the flexor hallucis longus is the most posterior of the structure that passes through the tarsal tunnel. So the correct answer is the tibialis posterior tendon, and that is option D. Yeah, that's the correct answer. So I believe you understand, and I will see you in the next episode. Thank you.